Out in the car park today talking about low back pain, scan results and the relationship between the two. Now, you might have had a scan on your back, you might have had an MRI, a CT, an X-ray to work out where the source or the cause of your back pain is. But I'm here to tell you that there's actually something that you may not be aware of, and it's this. There's actually no really strong relationship between what is on your scan and the pain in your back. Unbelievable. Okay, we used to think that all of these disc bulges, this disc degeneration, osteoarthritis, all of these different things that you might find on your back scan is directly related to your back pain. But as a matter of fact, it's not always the case. They actually did a study back in the late 1990s where they got a lot of people with no back pain, with no real symptoms at all. They put them and got them to scan, MRI scan, and upwards towards 40% of those people had really nasty backs. They had nerve recompression, they had disc bulges, they had all sorts of stuff going on, yet they had no pain in their back. So it's really important to recognize that if you do go and get a scan for your back pain, that it is there as another piece of the puzzle. It's there to give us a little bit of an indication as to what's going on under your skin there. But it's also really important to treat the person, not just the scan. So what does that mean? It's not just a scan result, one photo in time that we're looking at. It is also looking at the way that the muscles work. It's looking at the way or the contribution of the muscles themselves, because you can't see if they're tight or sore on a scan either. And also looking at what the movement is doing as well. So what movements are actually causing the pain, what activities, how it behaves, what makes it better, what makes it worse, and use all of those pieces of the puzzle to put it together to get the right diagnosis for you and your back pain. So what do we do here in the clinic to actually help that out? Well, on day one, what we do is we sit you down and have a really good discussion about how the back pain started, what aggravates it, what eases it, how it is in the morning, how it is in the afternoon, and what the different movements are that actually cause you the most grief. Any medications you're taking, what scans that you might have had, and what the goals are of treatment and what it is that you're wanting to achieve should your back pain improve. What we do then is we have a good look at your back, get you to bend and straighten, get you to do a few special movements to determine if it's a joint, if it's a disc, if it's a muscle, or if it's something else completely, if it's actually the way that your brain is interpreting the signals from the nerves coming from your back. And a lot of the time that does actually happen, especially if you've got chronic back pain, if it's been there for any more than say 12 to 18 months and hasn't really started to improve from there. What we might also do is have a look at your strength on the Med-X machine, our awesome machine inside the clinic, inside, not in the car park here, to talk about how strong your back might be compared to what normal is for your age, weight and height. So there's a lot of different options there. There's all sorts of dry needling, manual therapy, exercise treatment that can be done also from there. So we're looking at all of the pieces of the puzzle. We're not just having a look at one scan and going, well, it's definitely that. We're looking at all the movement, all the different treatments that you've had, what's made it better, what's made it worse, to put a really complete picture together to know what your back pain is, how it's being caused, and put together a plan of attack to actually get your back pain on the right track. Hey, I hope that's been helpful today. If there's any comments or questions, please type in below and we'll get to those as soon as we possibly can. I hope you have a really great day. It's a beautiful day here in Brisbane and we'll talk to you again soon. Cheers and bye for now.